your cardiologist nurse practitioner, I have a couple of nursing considerations and diagnoses. For a patient with cardiac trauma or cardiac tamponade, my first nursing diagnoses would be inadequate organ perfusion due to inadequate ventilation related to the reduced capacity of the heart to pump blood. For the first nursing diagnoses, my plan of care would include administering oxygen as needed to support adequate perfusion of organs and tissues. We would also collaborate with respiratory therapy. My second nursing diagnoses would be my patient would be at risk for hypotension due to fluid loss. My plan of care for my second nursing diagnoses would be to request an order from the physician for a vasopressor and a volume expander. These would allow the blood pressure volume to increase, which would make up for the hypotension. My third nursing diagnosis would be pain related to the cardiac tamponade and the constriction of the heart. Anti-inflammatory medications can help relieve the patient's pain. However, because of the potential for GI bleeding, administer these drugs with food or milk and instruct the patient to avoid alcohol. Other medications, such as a proton pump inhibitor, such as Protonix, may be ordered to decrease the stomach acid. My plan of care related to the pain includes both pharmacological and non-pharmacological measures. As a non-pharmacological measure, helping the patient sit in a tripod position may help relieve the pain from the cardiac tamponade. As a pharmacological measure, you can request a pain medication from the doctor, such as an anti-inflammatory medication. And finally, my fourth nursing diagnosis would be at risk for anxiety due to the sudden onset of cardiac tamponade. A plan of care to help the anxiety related to the cardiac tamponade or acute pericarditis include teaching and educating the patient of everything that is going on and helping her or him with relaxation techniques. The overall nursing diagnoses and our plan of care are used in order to establish our goals of nursing. These include to maintain an SaO2 greater than or equal to 90%, to keep organs perfused, to maintain blood pressure at normal levels, to keep a patient's pain at or below a 3 on a pain scale of 0 to 10, and to alleviate the patient's anxiety regarding his or her condition and what treatments are being used or will be used.